Fertility is complicated. I think sometimes, especially in conversations like that, it's many clients that I've worked with have been offered the pill as sort of the shorthand to kind of, address a symptom really quickly without looking upstream to any kind of root cause. And their experience, I think, has reflected that, where it hasn't actually addressed what's going on with them. And
Mm.
in many cases, it hasn't made a lot of other symptoms more manageable.
Welcome to Come Talk with Amy, the podcast where sex isn't whispered about, it's talked about out loud. I'm Amy, your host and intimacy coach, here to spark raw, playful, and unfiltered conversations about relationships, desire, and everything in between. No shame, no scripts, just real talk about what really turns us on. Let's dive in. Hi, everyone. Welcome to Come Talk with Amy. Yes. Today we have Kate Douglas in the house. We are going to dive into a topic we have not yet covered on here, which is fertility awareness and how it is tied into creativity and so much other yumminess. Katie, welcome.
Thank you. Thanks for having me.
Yes. Katie is a fertility awareness educator who is passionate about body literacy at all stages of life. Yes. She is the founder of Earth Body, an online hub for classes in cycle health for individuals and holistic professionals. She currently serves as the head of the research committee at the Association of Fertility Awareness Professionals. Hello. And she brings a multidisciplinary background in movement and body work to center the wholeness of a client. Yes, Katie, I love it.
Thank you.
Amazing. So tell me about what got you on this journey of becoming a fertility specialist.
I came to fertility awareness in my late 20s. I was looking for a method of non-hormonal contraception because I was in a long-term relationship and I was like, okay, I've really got to get serious about this. I'd never been on hormonal birth control. I didn't want to start. My friend suggested that I take a class in cycle charting and cycle mapping. And I was completely flabbergasted by what I learned. It was sort of just basic sex ed that I felt like I should have learned and when in my youth or earlier. I even doubted the material. I was like, no, it can't be true that I can't get pregnant 365 days a year. Somebody would have told me that. I mean, that doesn't make any. And that supercharged me in that class setting, I suppose. And it always felt like knowledge that I wanted to carry and teach. And I applied for the teacher training program quite soon after that. Gosh, yeah, I graduated a few years ago now, and I've been practicing through Earth Body, my online portal, ever since.
Tell us a little bit about Earth Body.
Earth Body is my excuse to talk to everyone that I want to talk to. I have a lot of interests, especially around cyclical wisdom and ecosystems. I'm really passionate about bringing together providers to talk about client work and interdisciplinary work and bringing everyone outside of their silos. I often think, especially in the wellness sphere, there's a lot of like this imaginary silo, as though like I could just sort of purify myself separate from any community or any sense of, where I'm living. And I really think that cross-pollination is vital to a deeper understanding on all fronts. So I host other teachers who do guest workshops. I have a podcast, Earth Body Podcast, and then I teach my core cycle charting classes to individuals. And I also teach professionals about cycle literacy. So people who like acupuncturists or massage therapists who want to incorporate cycle literacy into their work.
Amazing. So break down cycle literacy for us and tracking your cycle. What is it? How does that work? Why should we give a damn?
First of all, not all methods of cycle tracking are the same. Fertility awareness is a huge umbrella, and there's a range of efficacies and there's a range of methods. So I teach a symptothermal single check method, and that
Okay.
means checking 2 different biomarkers every day. Takes under 5 minutes a day. So it's checking your cervical fluid and checking your basal body temperature. And once you have this data, you put it on a chart and you know how to interpret it, you can use this method for contraception, conception, or hormone health and well-being. It's been my primary method of contraception for 8 years now.
And how is somebody actually physically tracking this? How are they obtaining that data?
Cervical fluid, they're doing it through cervical fluid checks 3 times a day. So that's getting familiar with what's going on down there, at least minimum 3 times a day if you want to use this for contraception. And basal body temperature, that's using a thermometer that can be a basal body thermometer. It just can't be a quick read thermometer. But you pop that in first thing in the morning before you've had water, before you've gotten out of bed, before you do anything. That's going to get your basal body temperature, kind of your resting body temperature. Those two biomarkers are downstream of the physiology of fertility. So, cervical fluid tells us about whether there's estrogen present in the body, more estrogen. That's when we see cervical fluid. And then the basal body temperature, that will rise in the luteal phase if ovulation has occurred, because progesterone causes this little spike in temperature in the body. So we're using those two biomarkers to see where we are in our cycle.
So okay, so basal temperature, I'm using a thermometer, likely oral, yeah, or whatever
Oral or
type of
vaginal.
or
Yeah.
oral vaginal. Okay. And then for cervical fluid, what is somebody doing? They're taking a swab. Where are they swabbing it? What does
You
that
could
look like?
just cervical fluid checks. I sort of walk you through it. Just got to basically get familiar. I teach sort of like a regimen. Like you're going to sit on the toilet. Anytime you're going to go to the bathroom, you're going to check for your cervical fluid. So first, you're going to wipe. You're going to notice the sensation when you wipe. You're going to see if there's anything present on the toilet paper. Ideally, you're folding the toilet paper beautifully, not crumpling it like I used to do. But folding it beautifully. You're going to see if you can pick up any cervical fluid. You're going to see what color it is, make some observations. And then you're going to do a finger check at the vulva. So that's just right where the tissue before it changes to the vaginal wall. Do a little finger check there. It's safe. It's not like going up to the cervix, so you don't need to wash your
Uh-huh.
hands. It's all good. And you'll do a finger check there, and you'll see what's going on. You'll see if you notice any secretions and what kind of color they are, what texture they are, etc.
Okay, so one, this seems like a very accessible method. Two, depending on the color, the texture, all of that, the amount maybe, all will tell you where you are in your cycle.
Exactly. Yeah. So we look at cervical fluid to open the fertile window. So to open when we might possibly conceive, possibly. Then we use basal body temperature and cervical fluid to close that window. But the color, the texture, the sensation, all of those will tell us, we call in the method of fertile or super fertile fluid. It's basically a way of saying estrogenic or highly estrogenic fluid. The more
Mm-hmm.
highly estrogenic fluid that you're seeing, it's likely that you're closer to ovulation.
And then you mentioned luteal phase. Can you break that down for us as well? What is that?
The luteal phase occurs after ovulation. So after this amazing hormonal dance that is ovulation takes place, the egg ruptures out of the follicle, and that empty follicle that was once full and once secreting a lot of estrogen now secretes this hormone called progesterone. And that causes our basal body temperature to spike a little bit and also dries up the cervical fluid. So the luteal phase, it parallels the length of the life of the corpus luteum. So that's 12 to 16 days maximum, usually.
Huh?
And that's when we're getting all these incredible effects of progesterone, which is sort of it has a range of functions in our bodies, whether that's, stress adaptation, it's a tumor protective, it's neuroprotective, it helps regulates our blood pressure. If we are trying to conceive, we often say that estrogen is what gets you pregnant, but progesterone is what keeps you pregnant. There's a lot going on with progesterone and in conversation with estrogen.
How is this fertility tracking different than your run-of-the-mill generic period tracking apps that are out there?
I mean, I used to think I was doing the most because I had a period app before. I was like, that's all you need to track. I thought that the period was
Huh?
kind of the star of the cycle and that's what you were meant to be tracking. But if you're just tracking your period, you're missing about 80% of what's going on hormonally
Mm,
in your cycle. Some apps are great. They're useful places just to store data, but other popular fertility apps are a little bit of an issue for me personally because they rely heavily on algorithms, mathematical
okay.
predictions, basically based on your past cycles, past research, and other users to make predictions, especially about when the app thinks you're going to ovulate, when are your safe days. But the truth is, your cycle is not only unique to you, but it's also not necessarily the same month to month because life happens.
Right.
So a lot of these apps aren't going to cut it if you're looking to avoid pregnancy. Also, depending on where you are, it's a lot of sensitive data that's on that chart. Depending on what you're charting, you might be charting, pregnancy intentions, etc. So that has a lot of implications. It's very valuable data to some companies, and that's another kind of issue that I like to raise with clients. Yeah, I think those are the big ones. Ovulation may not occur the same day every month, which is one of the biggest issues I have with the predictive apps in particular. And the method that I teach is not predictive. We confirm ovulation in retrospect. So no one can predict ovulation. That's between you and your body. That's what I like to say.
Right. And a lot of times, like, think of ovulation specific to like pregnancy. What is like the bigger story in what you do
I
and what you
love
teach
this
clients?
question. Yes. Ovulation is about so much more than just reproductive function. I always cite the singer and producer Lorde, who calls
Uh-huh.
ovulation one of the best drugs she's ever done, which is so rock and roll. And
Yeah.
why is she saying that? Biochemically, ovulation exposes us to these balance of hormones that we've already been talking about, estrogen and progesterone. Over a lifetime, these decades of exposure to this balance of estrogen and progesterone builds the health of all these different systems in the body. So that supports long-term brain health and bone health, supports the immune system, can reduce dementia risk, heart disease risk. So it's really this superpower function of our body, and it's been collapsed down to its reproductive output. A lot of people don't even know if they're ovulating unless they are in conversations with their provider about whether or not they're want to conceive, basically. And that's a big loss, I think.
Yes, absolutely. Juicy, juicy. You've mentioned like the different hormones, right? Let's unpack and dig deeper into estrogen. What is estrogen? What value does it have for us, not just hormonally, but like, does it impact confidence, verbal fluency, like all of the other aspects of estrogen? Speak estrogen to me.
So happy to. Estrogen, as we've been saying, is the hormone that drives a lot of the action in the first half of your cycle before ovulation and your reproductive years, right? And it's got a range of functions in the body. So that includes glucose homeostasis, that includes neural functions, that's bone health, that's a whole bunch of different whole body effects. But beyond that, estrogen plays a role in regulating hormones like serotonin and dopamine. As you approach ovulation, this estrogenic peak, it can totally enhance mood, can enhance confidence and focus, right? And estrogen also is linked to the production and effect of endorphins, your feel-good chemicals in your brain. The research here is complicated, but some studies have shown improvement in verbal abilities around ovulation, and other studies say there's no evidence of that kind of cognitive shift throughout the cycle. But I will say what's so interesting about those studies, and one in particular I read, notes that the participants in the studies all report subjective differences throughout the cycle. So something is
Interesting.
happening with how we view ourselves, our abilities there, right? I could get more into like the brain, how the brain is shifting as well, but that's a whole other conversation. And we need
Right.
more we need more research. But essentially, I just think ovulation exposes us again to this like beautiful biochemical opening and possibilities, I would say, right? And we might be more receptive to making that pitch, or like, the neural it might be easier to think of new ideas. There's actually some small studies that found that participants had more original ideas around ovulation compared to other parts of the cycle.
Interesting.
Yeah, and another one showed that women who were not taking oral contraceptives, which can suppress ovulation,
Mhm.
women who are not taking oral contraceptives had more divergent thinking and higher levels of creativity when estrogen was high and luteinizing hormone was high, which is around ovulation. So
Okay.
this is really fascinating to me. And these studies link it back to this sexual selection hypothesis that enhanced creative potential it's a sign of reproductive fitness, et cetera, et cetera. There's something I think in zooming out about this portrait of increased openness. It's mirrored in the body. This is also the time of our cycle when the portal of the cervix literally opens, potentially to conceive a baby. There's something about that to me. I think it doesn't necessarily have to be conceiving a baby. I think there's there's more openness in this time, I think. Not everyone experiences it that way. I want to leave space for that. I read a lot of material where people say that, we should all feel, this is when we feel at our peak. And that's not true for all my clients. So I definitely want to
Huh?
name that. Physically, there is a kind of biochemically, physically, there's something going on here where we are psychoactively different around ovulation and versus other times of our
Interesting.
cycle.
Ooh, okay, so that's when I need to be doing pitches, booking my clients, like, right?
Yeah,
All right,
I think so. I
heard
mean,
it here.
you should watch and see. What I always tell my clients is you can sort of first step is before any kind of rearranging your life is just to watch your cycle and see what happens. And one of the most empowering aspects of cycle tracking to me is that yes, you're tracking your cervical fluid, yes, you're tracking your basal body temperature, but you can also track other possible symptoms, like your mood, like your appetite, like
Mhm.
your arousal. You can track all of these things, and then putting them in a cyclical context is so empowering for so many of my clients because, they would have a dramatic mood swing every month, but when they see it on their charts, they go, "Oh, I see when it's happening." And then also they might have more tools then to address it or support it. It's not mysterious. It doesn't always randomly strike in the middle of the night.
I love that. Going to your clients, like, why are people coming to you? Like, why are they knocking on your door? What solution are they seeking? And also, what are like some surprises that as they go on this cycle tracking journey that like they come out on the other end realizing that they didn't know that they were going to get?
Love this question too. I teach two cohorts. So I teach a charting to conceive cohort, and that's for people who want to chart to conceive. And then the other cohort I offer is natural birth control and hormone health. And I would say for both, I think people come for a range of reasons and a range of goals. The practice is such a gift, I find, because it's a tool that can meet everyone where they're at. And that's one of the great things about working with an educator, I think, is that I help clients use fertility awareness to achieve their own goals and needs, whatever they are.
Mhm.
Many clients have told me that they might have come for a practical goal. They might have come because they were looking for a non-hormonal method of contraception, but actually the practice has become something deeper than that. It's sort of a more of a meditative practice of a way to foster this dialogue with yourself. You're checking in with yourself on a regular basis. You're noticing patterns with yourself over time. And I would say that we maybe don't exist in a culture that allows for that kind of space to really check in
Absolutely.
with what is happening with your body and to become a real partner in your healthcare in that way. That's been one of the biggest surprises for me. I was able to seek out a fibroids diagnosis because of what I saw on my chart. And had I not been charting,
Okay.
I wouldn't have known to ask for that. It's a gift, I would say, through many different thresholds of life. It often takes people by surprise. They come for a very practical reason and they leave with, I think, a deeper relationship with their bodies.
Yeah, absolutely. Is it kind of an either or is it a yes when we think of birth control, right? So are people cycle tracking and also on birth control, or are they cycle tracking or on birth control?
To achieve to use the full practice, we need both biomarkers. So we need cervical fluid and we need basal body temperature. A lot of birth control suppresses ovulation or will kind of potentially mess with one of those biomarkers, right? So
Mhm.
that's sort of their function. They're flattening out that hormonal dance that we've been talking about. They're suppressing ovulation, many of them. So I work with clients who are preparing often to come off of hormonal birth control. I meet them in that way. But many people that I see to chart or they've just left, they've sort of like just stopped the process. What I will offer is that again, cycle charting is a tool that you can layer on top of other contraceptive practices. So you can use this in addition to a barrier method. You can use this in addition to like creative intimacy.
Huh?
There's lots of ways that this can fit into your life and depends on where you fall on the what I what in the practice we call the conception intention scale. Like if you're a 0, if you're like, I do not want to be pregnant, full stop, no, no, no. There are certain choices that you might want to make that are a little more cautious around, and cycle charting can help you do that. Versus if you're a 10, you're like, I want to conceive yesterday. That's going to be, you might have a totally different approach to cycle charting and
Right.
what you do that way.
Yes. Okay. So I want to use condoms while I'm cycle tracking because my goal is not pregnancy, but it's like a great option for all the other benefits you've, mentioned outside of the aim of pregnancy, but adding like a barrier method on top of cycle tracking is a great way to for people whose goal is not pregnancy.
Absolutely. So with cycle tracking, you'll know your fertile window. So you know when you can possibly conceive, so you can make informed decisions around that. So maybe, if you're a 0, maybe you use a barrier method and also withdrawal. That's sort of the bespoke choice and agency that I think cycle charting lets you have. I'm teaching you a set of rules, yes, but it's not dogmatic. It's not saying it's this or nothing. It's here are the rules, and let's see how this fits into your life, your goals, your choices.
Yes, I love that. Okay, going back to ovulation, if someone feels like completely flat, right? Wait, like you were mentioning that not every client feels like the spark of energy. What could that signal? Like, does it also help signal some other, things going on in the body?
Well, my first question would be, are they actually ovulating? Because most people think just because you're bleeding, that means you're ovulating, which is not the case. And ovulatory cycles eventually have breakthrough bleeds. That's when the uterine lining gets released, but that's not what we call a true bleed. A true bleed only follows ovulation. So for instance, going back to hormonal birth control, if you're on a hormonal birth control that suppresses ovulation, I've had clients say like, well, but I'm still getting my period, so I must be ovulating. Not necessarily. That's not a what we would call a true bleed. And if you're not feeling great around ovulation, or if you're feeling flat, I should say first that there are lots of reasons other than hormonal birth control that an ovulatory cycle can happen. That's
Okay.
chronic stress, under eating, over exercising,
Yeah.
perimenopause, thyroid dysfunction. So all of these can have an impact on ovulation. So that would be my first question, because without ovulation, there's no hormonal dance. There's no hormones will basically maybe look like a flat line, the most part, possibly. That'd be the first thing that I would investigate.
And then, because this was actually going to be one of my next questions, what does cycle tracking look like in perimenopause? Because perimenopause can be a 10-year situation, right? And
Yes,
there's also fertility can happen in those
that's
10 years. Surprise.
it is. I've worked with clients who are just coming to cycle charting during perimenopause, and I will say it can be complicated. I would argue that it's still very valuable because it's again giving you this sort of physiological framework and also tracking data over time, which you can use in conversation with your provider about a range of things during perimenopause. But if you haven't been tracking your cycle for years before, it can be a lot of novelty at once. And you may be coming out of this rhythm that you've had for many, many years. You might see patches of cervical fluid that rise and disappear. You may see anovulatory cycles. You may see very short follicular phases. Those are the first parts of your cycles. This is again where I would suggest working with an educator, because that's sort of a lot of complexity to navigate on that analysis piece. But again, the cycle charting rules that I teach you, there are protocols for all of these. So if you are looking to avoid pregnancy, there's a lot of tools at your disposal, and tracking daily will help you basically see what's going on, and then you can make your choices accordingly, depending on where you fall on that intention scale.
Yes, I love that. And is there ever a point where it's people should then take this information that they're gathering to a provider to get more consultation and information?
I'm such a big advocate of this. I know firsthand how cycle charting has changed my healthcare conversations. It helped me build up the confidence to ask for a ultrasound to check whether I had fibroids or not. That was not on
Mhm.
my OB's agenda that day,
Yeah.
but I had the charts, I had the data, and I was able to provide those to request one. I think there's a range of reasons you might want to show this to a provider, whether that's your PCP or someone that you're working with, like a nutritionist. If you're trying to conceive, for instance, and you're working on lengthening your luteal phase, and your nutritionist puts you on a plan, you can then show them 3 months of charts to see what is that working, or like, is that expensive supplement actually making a change positively or negatively? You'll have the data to show. And with your PCP, there's a lot that you can see on a chart that's including, thyroid issues that may require some deeper investigation, luteal phase deficiency, that's another one. Whether or not you're trying to conceive, that is something that should be investigated. There are so many reasons that this is really, really valuable data to bring in conversation. And in my experience, it makes you a real partner in your healthcare. It gives you a little more confidence. It's not you coming in saying, I feel like my cycle is changing, I feel like something is off, you
Mhm.
can come in with data saying, this is what happened 2 cycles ago. And maybe that was a one off, but I wanted to bring it up in conversation with you. I love talking about this. And if you are, if you're down, if you're a provider and you're down, please reach out to me because I always want to talk to providers who want to read charts and talk charts with me.
I love that. And also, like, I guess to piggyback on that too, for have you come across this or your clients navigating when, because medical gaslighting is alive and thriving? I say this as somebody who works in healthcare, and
Hmm.
has also experienced my own forms of medical gaslighting as a person who's been in, a
Hmm.
patient or person, a client seeking healthcare assistance and different things. There's a difference between a provider like not being familiar with it and it's like, okay, tell me, but being receptive and hearing versus like not being open to it at all. What does that look like for you or for clients who may have had negative provider interactions? How do you help people navigate that?
I think that zooming out, when you chart consistently and you are checking in with yourself and you learn how to advocate for yourself using your charting data, you become more fluent in your charting data. You develop a deeper understanding of your body and your health patterns. I think that is supportive of this positive feedback loop where, like, the more you understand your body, the better questions you ask, the more effectively you can advocate for the care that you want. Charts, when you come into to see your provider, healthcare providers work with evidence, and your charts are evidence. So you
Yes.
can present them with months of carefully recorded observations. You're shifting the conversation again from, I think my periods are irregular, to ovulations not occurring, or my luteal phase is shorter, or my follicular phase is shorter. And you can talk about the concerns that you might have. I'll say this is also so useful because medical appointments are often crushingly brief, which is enormously frustrating. And I know I often forget a lot of important details when I'm nervous or pressed for time.
Right.
But your chart is so specific. So healthcare providers can understand your unique patterns rather than textbook averages. This is huge for my clients who are trying to get hormonal tests. Very often,
Amazing.
you're going in and you want the most accurate testing timing possible, and your provider doesn't really, they'll say, take this test on day 21, but that's not actually what, if you don't ovulate on day 14, that progesterone test on day 21 maybe won't, it's not going to be as valuable to you as a test that is actually done 7 days after you have ovulated. This data is so crucial, especially for addressing underlying issues. And my hope is that this practice not only helps us navigate overwhelm, it becomes a filter through all the noise, and it lets us, in conversation with providers, make informed decisions about our body's responses. And maybe that's also, you need a provider who's going to take your concerns seriously, if that is an option.
Yes,
Yeah.
stay tuned for the next time we have Kate on the podcast talking about medical gaslighting and fertility tracking.
God. That'll be a 3-hour episode.
We love
There
it.
will be music.
Parts 1
It'll be a
and part
musical.
2
I'm
with
down.
Amy serenading in between.
Love.
And
Love.
throughout. So, this is a sex podcast. So, we cannot have a guest on and not talk about the potential impacts of the topic on sex. Cycle tracking. How does it impact sex, if at all? When is the best time to have sex? I mean, hello, all the time. But how does sex fit in the conversation of cycle tracking?
Yeah, so let me even just take fertility out of it, because essentially that's one of the big things that we're tracking about. Like, when you could possibly conceive is a big thing that you're tracking. Unlike what I was taught in my fear-based sex ed, you cannot conceive 365 days a year. Though that's what I thought. I thought someone looked at you the wrong way and you could get pregnant. That's what I thought. So let's put that
Boing.
aside. Let's put that aside for a second. But this hormonal dance, I'll talk about estrogen first, but with the presence of estrogen, cervical fluid changes. Your skin can change, your libido can change for many. I work with a lot of clients who find that their levels of desire, and also who they desire intimacy with is different depending on where they are in their cycle.
Oh,
I mean, it can feel like perhaps what I was saying before, like some kind of opening. You might be more receptive, you might be more into it around at highly estrogenic points in your cycle, and maybe your luteal phase, you're not feeling it so much, maybe right before your bleed, not the best time. Lubrication wise, I would say, you're going to have more cervical fluid. And one of the functions of cervical fluid is, reproductively, it's like a little bit of sperm snack on one sense, but it's also lubricative. Basically, in the context of the sperm's journey to the egg, sperm needs an alkaline environment, it needs warmth, and it needs nourishment. So seminal fluid will give sperm a little bit of food, but not everything it needs to make it all the way to fertilize an egg. So for instance, the lifespan of sperm after ejaculation, if someone ejaculates into the air, sperm live less than an hour. If they ejaculate into someone with no cervical fluid, sperm will live 1 to 3 hours. But in a vagina or cervix with cervical fluid, up to 5 days. Usually a little
Those
less, but
sperm
up to
are
5 days.
hungry.
They're hungry. Yeah. So that's, again, one of the principles that underlies some of the rules that we teach in this course about why we have certain protocols, why do we watch and wait after what we call peak day, etc. But that life of the sperm, and the presence of cervical fluid is part of what informs the rules of cycle tracking.
Yes, we love that. Sperm snack. Add that to your dictionary, your mental dictionary. I know you all have now. That's amazing. Continue your other thoughts. Sorry about that.
Okay, we were talking about ovulation in the fertile window. You might, mood, appetite, skin changes, confidence changes. As you approach ovulation, testosterone is actually also peaking around ovulation. So that is also linked to assertiveness. So I think all of those have downstream effects on definitely sex and intimacy, but also I think a lot of your your inner circle, perhaps, I would say.
I love it. So the times that I'm that bitch, people, is I am ovulating. Okay.
That's right. Rock and roll. Rock and
And I'm
roll.
that bitch always. Just kidding.
Yeah.
I love
365.
it. Yes, exactly. But I'm not ovulating 365 days a year.
Oh, exactly. You like, great. If you take nothing else from this podcast, that's it.
That is it. I have actually, it's my guest who has a podcast called The Birds and Bees Don't Fuck. So her podcast is all about like sex education that we didn't get, hence the name, right? Because we're hearing about the birds and the bees and just going back to like the 365 days a year, thinking that you can get pregnant. Like, that's not the truth, right? We're breaking that down, which I feel like is a perfect segue to go into myth busting because we love to bust myths here. So, what is the biggest ovulation myth that you want to retire immediately?
Beyond that you're not potentially ovulating and or fertile 365 days a year, I think the other one is that you can feel ovulation happening. I think a lot of people they say energetically I can feel when I'm ovulating. They might have ovulation pain, which is sort of like if you haven't felt it, it can feel like an ache usually on one side of your lower abdomen, maybe in the middle of your cycle. But I will say that you cannot reliably pinpoint it without tracking. I think actually one study on ovulation pain in particular found that over 60% of the time it was nowhere near the actual day of ovulation. It was over 6 days difference. So I would say that's probably the biggest. You shouldn't be relying on a feeling to make, especially if you're making decisions about contraception. You shouldn't be using just your energetic feeling about when you're ovulating. You should learn a method to track the
Yes,
cycle.
we need that data. We need that data. Yes. So day 14, tell us what that is. And is it real for most people?
Day 14. No, this is another myth. Day 14 is not real. Day 14 refers to the ovulation day of a quote unquote textbook cycle, which in all of the dozens of charts that I've looked at, I don't think I've ever seen a quote unquote textbook cycle. There was one study in 2020 that over 32,000 participants that found that only 12.4% of women had a textbook 28-day cycle. Over half of participants had cycles that varied more than 5 days every month. So again, this is another reason why you really want to pinpoint ovulation accurately. There's another study that I cite all the time from 2015 that showed that ovulation can range in participants, or in that study it did, between day 8 and day 26. And day 14 wasn't even the median day on that study. Chances are you're probably not ovulating. You might be ovulating on day 14, but you might not be. And it's the reason for a lot of confusion around, whether that's you're trying to conceive and you're not timing intercourse accurately, or you are trying not to conceive and you're using something like natural family planning but you might not knowing you would be ovulating outside of this window. So the calendar method or any method that kind of looks retroactively at your cycles, I would include apps in that, is going to be less reliable than looking at your fertility in the present tense.
Yes, fabulous. As you're talking, I'm seeing the sloughing off, which we'll get to in a minute, but all of these things from my nursing days, my
Oh.
nursing school days. Anybody who has ovaries or has had them and knows that no period is typical, right? Your own
Mhm.
period is like you can have some like standard things, right? But like there's even if you're on hormonal contraceptions where they're like, "Oh, it's guaranteed that it's like clockwork." No. Like I've
Mm-mm.
been on that. I don't like I can't do the hormonal contraceptive because it makes me
Yeah.
really sick. But yeah, it's not clockwork even on that, even though they guarantee that. Like there's so many different factors, which you've given us
Yeah.
so much to digest.
Fertility is complicated. I think sometimes, especially in conversations like that, it's many clients that I've worked with have been offered the pill as sort of the shorthand to kind of, address a symptom really quickly without looking upstream to any kind of root cause. And their experience, I think, has reflected that, where it hasn't actually addressed what's going on with them. And in many cases, it hasn't made a lot of other symptoms more manageable. It's
Yeah,
complicated.
no, I was put on a hormonal contraception I wasn't having sex, right? I was a good Mormon girl that was not having sex, but I was put on it because I had an ovarian cyst, right? And so, which is cool, like whatever, but that shit made me so sick, and it was like I was totally out of whack with it.
I just wrote a blog post about ovarian cysts, and yeah, it's so common that people are put on hormonal birth control to address them, but it doesn't actually address the underlying root causes of ovarian cysts. So it's very frustrating for a lot of clients. So you're definitely not alone in that
Yeah, no,
experience.
I was like, "Take me off that shit." And then I started having sex, no.
Rock and roll. That's
When is a good time for somebody to start cycle tracking? I mean, in addition to obviously what you said, like preparing for coming off like hormonal contraception, preparing for fertility, are there other key times? And like, what about teenagers? Like, is that a good entry point or is later in life a better entry point?
I think this body literacy, I think I wish I had had it earlier. I think it would have changed a lot about how I felt about my body, especially when I was in my teenage years. I would say there's a lot of conversation to be had about responsibility and agency in that time, especially around contraceptive choices. But I do think for me personally, I really do advocate for body literacy from the first bleed, because I think you should understand, you have a right to understand what is happening with your body and what's going on, and as it's your body's steward. So I'm a big advocate. I'd say if you're curious about cycle charting, just drop me a line and I'm happy to tell you about it. You should find a method. I suggest finding a method that works for you. So not just you can be a little bit adrift if you sort of just start tracking, but you don't understand the analysis component. You like maybe have got, that you're going to take your temperature, that you're going to do check your cervical fluid, but unless you're working with a method, you may not have the heuristic to sort of put that in context and understand what the data is telling you. So there's a range of different methods out there. I would say look for some educational components. You can definitely learn from a book. I benefited a lot from engaging with an instructor who could provide some bespoke insights into what was happening with my chart, but that's just how I learn, and other people can learn from a book, which is rock and roll.
We love it. So
Yeah,
many different approaches you can take, but
totally.
a method, you're like, that's what I'm hearing from you is like, have a specific method so that for ultimate success, right?
Yeah, that aligns with your lifestyles and goals. There are some methods that are religiously affiliated. There's some methods that add in hormonal strips, like LH strips, and maybe,
Mm.
it also depends on if your cycle's irregular and efficacy is really important to you. You may go with a different method than somebody who is trying to conceive and maybe just wants kind of a general sense of what's going on about whether they're ovulating. Depends on.
Yeah. What is feedback that you get from partners, if any, like partners of people who are tracking?
I mean, we actually just had a partners class inside my charting to conceive cohort on
Yes.
sperm health and sort of the male factor, fertility factor in conversation, which I think gets left out a lot in conversation.
Oh, male
And
responsibility for anything? Shocking.
I'm gonna say no, but I think there's culturally there's something there. There's actually I opened the class with this cartoon of Homer Simpson, which was pulled from a study. This study opens by quoting Homer Simpson and saying, "I never knew that fatherhood was something that could affect a child," you know, and
Accurate.
I think that is the culture that all of us are sort of swimming in. Most of us are swimming in. And in my experience, especially in this cohort, it's not actually from a lack of interest from the partner. I actually just think there's not enough resources
Mm,
and there's such an enormous industry around egg quality, female fertility that is sort of can feel maybe impenetrable. I suppose. But there's a lot to say about sperm health and pelvic health. And I do think that that should be part of the conversation. I know that it's changed my
absolutely.
relationship. I know that it's changed other of my clients' relationships in terms of should we not only shared responsibility because this method is not for everyone. It is more user dependent and it does require you to talk through what would happen. You know, if we did conceive, if we're trying to avoid right now, but if we did conceive, what would happen? Putting that all on the table with a partner, that kind of communication, that can change the dynamic. I hope for better in a matter of transparency and trust. And it can also, in my experience, give you a little more vocabulary around what's going on with your body on a day-to-day basis. So you can ask for the support that you need. You have a
Yeah.
little more context for your own experience, can get more granular in what you might need from your partner in that moment.
We love that. We love that. And for our sperm shooters out there, as you remember earlier, and please take this away, a sperm snack, right?
That's right. That's right. That is right. I mean, and I would love to teach more partner classes because I also think one of the shocks is that most of the people that I've seen are shocked that you can consider. They're like, well, I thought I learned in sex ed that I thought she could get pregnant anytime, which isn't true. You know, like we
Mm,
all went through that sex education, which was lacking in so many areas. So can't wait to
oh my
listen to your
God.
episode on the birds of the bees. That sounds
Yes.
really valuable.
Yeah, well, and if you I mean, I do have I grew up in Mormon, and so we talk a lot about kind of like my religious context in that. I think we get into my relationship too, I can't remember. Stay tuned. Check
Can't
that out.
wait.
We love
Can't wait. We'll tune
Yes,
in.
yes, definitely. This has been fucking fabulous.
Oh my
Kate, is
gosh,
there
you're
any
fabulous.
Yes. Okay. Kate, is there anything that we have not talked about today that you're like, the Come Talk people need to know?
We've covered a range. We've gotten into a lot. We got into sperm, we got into ovulation, we've gotten into cycle tracking. I think we've hit the key markers right there. And the
Okay.
apps, we talked about the apps. We talked about healthcare. I think this is a pretty good lay of the land.
We did. This is totally random, but I'm going to share it because why not? Because so much of this discussion did bring up my healthcare, learning a lot of stuff about, cycles in healthcare, et cetera. For the limited amount that, we do learn, they do cover some of it as far as like the different phases and stages of the menstrual cycle. So, as I mentioned, I'm a nurse. My nursing training in the OR. So, I hate the OR. The OR hates me, let's put it that way. And there was this one part where it's like you get, in nursing school in the OR, you get to follow a patient from the intake to them being discharged from the OR,
Wow.
to like going to the after the med hall or whatever, or not hall, but like med surge floor. Anyways, so, I get to know this person and I'm talking and she's there for a double oophorectomy, right? So she's having both of her ovaries removed. Yeah. And so lovely couple, like I get to know her and her husband. Oh my God, the human body is so amazing. And also like, so then surgery, people
Mhm.
are intubated. So basically I fainted while she was having her oophorectomy and they were opening up her abdomen. And all of a sudden I'm like on the floor and the surgeons, the whole medical team were like around me. This was at the University of Utah. And then they're all talking about the first time that they fainted in the OR. And it was this whole thing. The ovaries have stuck with me ever since then. Anyways,
That's a major surgery. Yeah, I
it's
wouldn't.
a
I mean,
major
I'm
surgery.
major
Yes.
surgery.
Yeah, and I don't know how graphic do we wanna get with what was going on, but they're intubated, and I really struggle with intubated patients. patients. Intubation, there's a tube going down the throat into
Mm.
lungs so that they can manually, the person is sedated, general anesthesia. So they have to be able to control their breathing, right? And so they're put on a machine to breathe. And the eyes are taped so that there's not eye movement, right? I'm
Mhm.
like sitting at or standing. I eventually was sitting, laying on the floor, and then in a wheelchair. They got a wheelchair for me. And then all of a sudden, they're doing the incision, very large incision. And they're literally, for people who are listening to this and not hearing, I'm putting my hands out. There's probably 4 people, 2 on each side, physically
Wow.
stretching they had tools on them, right? Surgical tools, but like physically stretching open the abdomen. And that's at the point where that's the last part of the surgery that I saw because I woke up on the ground after that.
Oh my gosh. This is so
Like,
yeah,
oh
I
my
think
God.
it's hardcore. I think a lot of these gynecological surgery in general is just it's really hardcore. It's really
It
hardcore.
really
And
is.
these organs down there are so intelligent and so, they're portals of life, and it's just unbelievable. And there's still aspects of that we don't fully understand of the physiology. I always think it's so compelling. I'm like, medicine knows a lot, but there's also some things that we don't fully understand. Like when the egg is ovulated, when it ruptures out of the follicle, it's summoned into the uterine tubes by the cilia, by these like
Yes.
little
Villi.
strands at the end, yes, at the end of the uterine tubes. But no one fully, they don't fully know what that summoning is and how the egg knows to go, what is this pulsing? It's
They're
just
like
quite,
little sirens.
yeah, like
They look
siren
like
calls.
how can we put it? It's kind of like is it octopus?
Yeah,
What
I
has
would
the
say like thin,
tentacles?
very thin, like a sea anemone almost.
Yes, yeah, I'm just
Yeah.
trying to, like, visualize for people.
Visual, yeah,
Yeah,
because
like,
we're just grasping with
we're
our
just
fingers.
moving our fingers.
We're
Yeah, that's the most
jellyfishing with our
fun.
fingers.
Jellyfish, there you go, that's what I was thinking, like, the jellyfish, like, with the strands, like, that's kind of what the
Yes.
like, so funny. Interesting. So that was a big aside, but,
Beautiful side.
I'm a fainter. That is
I would be, I
something.
think many of us would be in that context.
Anyways, let's get back to the show. Kate, this has been amazing. Before we sign off, we love to come to completion here at Come Talk with Amy, aka Rapid Fire Round. Are you ready to come to completion?
I'm ready.
Yes. Kate, ovulation feels like blank.
Ovulation feels the volume gets turned up on everything.
Yes. Oh, we love it. Turn up that volume. Creativity during ovulation is.
One and the same. Ovulation is a creative act.
Ooh, I think we just came up with the title of
I
this
love it.
episode.
I think that's it.
Ovulation.
Yeah, ovulation is a creative act
Charting is empowering
because data is agency. And when you know what's happening with your body, that's an education that no one can take away from you.
beautiful. Okay, the biggest lie about hormones is.
That they make you unstable. They
Yes.
you know, this pervasive myth of like, oh, just being hormonal. I think there's a difference between imbalances and being dynamic. And we live in a world that supports linearity, I would say, and
Mhm.
like linear growth and maybe not growth and decay or cycles and cyclical beings.
Damn. I'm not going to end there because I have some more other questions, but that will definitely end up being a short clip for sure.
Oh, cool. Rock
Okay,
and roll.
right? Libido and
Yeah.
creativity are.
Libido and creativity are one and the same. They're creative
Hmm.
expression running through different channels. So I think if you suppress one, the other channel might go quiet as well. By turning up one, maybe you can turn up the other.
I totally agree. 1,000%. If someone wants to feel more connected to their cycle, start with.
Start with checking in. Start with listening. Listening
Mhm.
first before running to any kind of interventions or trying to reorganize your life according to some cycle syncing protocol that you saw online. Start with
Yes.
listening to your body and writing it down.
I love that. 2 more questions. One thing that you wish social media got right about ovulation. We live in this digital age.
Boy, I would say it's probably that it's just a fertility event. That this myth is that it's just a fertility event. Ovulation is this whole body, whole brain phenomenon, and it belongs to everyone, even if they never want to have a baby. Full stop.
Yes, I love that. Okay, and body literacy gives you permission to
Body literacy gives you permission to be in dialogue with your body in the present tense, not the body you had last year, not the body you wish you had. It's your body in the present tense right now.
Damn. Yes. Okay, Kate, this has been amazing. I'm so glad that we met and we need to meet IRL over a
Yes!
coffee. I would love that.
I want more of
And
your OR stories.
my goodness, yes. Before we wrap up, Kate, where can people find you and continue following you and your work?
You can find me across channels at Hello Earth Body on Instagram, on Threads. Website is helloearthbody.com.
Fabulous. And we will have that linked in the show notes. I want to know for people listening at home, what are your takeaways? Have you gone to the bathroom and started cycle tracking mid podcast? We need to know. Reach out to Kate.
Would love that.
Yes,
Yes.
right? Tell us how
Yeah.
many. I want to know the data. I want to know the data on how many of you have done that. We love you, but I got to say, remember to masturbate, lubricate, and get it. Thank you for coming. Please come again, and come again.
That's all for today, lover. Remember to masturbate, lubricate, and get ate. If you liked this episode, share with a friend, like, subscribe, and as always, thank you for coming. Please come again, and come again.